Hi everyone, my name is Anna Rucker and today I am going to discuss the importance and purposes of functional behavior assessments and functional analysis. Majority of my field experience has been located in clinic. However, I do have some experience in schools and in home. After I finish school and pass my board exam, I plan on working full-time in the clinic. I feel like working in clinic allows the most opportunities for students to learn and gain extensive knowledge from supervisors with many years of experience. Working in clinic also gives you the opportunity to be more hands-on with clients, but not only that, it also gives you the opportunity to teach other RBTs, BTs, and future BCBA students as well. I honestly do not have that much experience doing formal behavior assessments on clients. I do have some knowledge of what a behavior assessment consists of from learning about it, being assigned individual assignments throughout the program, and asking my supervisors questions about it. I am constantly finding myself informally figuring out the function of many of my clients' behaviors and thinking about the antecedent of what had caused the behavior or what the reasoning of their function could be. According to Pennsylvania Department of Education, functional behavior assessments, also known as an FBA, is a process for identifying problem behaviors and developing interventions that can be used to improve, decrease, or terminate those challenging behaviors. Individuals with severe challenging behaviors can have many serious consequences. For example, it can affect many individuals that are involved in their life. Consequences may include, but are not limited to, injury or death amongst themselves, and depression and anxiety can affect the families immensely. So, when should professionals conduct these behavior assessments? As of now, it is recommended that professionals address problem behaviors by first conducting a functional behavior assessment, which can then be followed by a standard functional analysis. After both the FBA and FA has been conducted, then a professional will implement a function-based intervention. For example, differential reinforcement of alternative behavior, other behavior, incompatible behavior, extinction, and so on. According to Ali Rosales et al., the goal is to develop and implement procedures that can eventually reduce the rate of problem behaviors while teaching individuals functional and social alternatives. Some factors that can affect individuals with autism spectrum disorder, also known as ASD, are impaired social interactions, communication skills, restricted and repetitive behaviors. Individuals with ASD tend to experience other factors such as emotional behavior problems that are commonly referred as problem behaviors or challenging behaviors. Other things to consider when discussing problem behaviors are self-injurious behaviors, also known as SIB, aggression towards others, tantrums, and non-compliance. Some of these issues have an absolute effect on individuals with ASD and contribute to their problem behaviors by making it difficult for them to functionally live their life day by day. SIB tends to occur amongst these individuals due to the difficulty of being able to communicate their wants and needs, therefore leading to challenging behaviors. According to Lewis et al. 2015, from 1980 to the early 1990s, the majority of research on functional behavior assessments, functional analysis, and functional communication training were conducted within clinical settings. However, due to increased evidence-based research regarding these assessments, they extended into schools, home, and other settings. Then, in 1997, the Individuals with Disability Education Act, also known as IDEA, mandated that FBAs must be conducted to develop a behavior intervention plan. if a child were to participate in challenging behaviors at school, therefore resulting in an increase in research within school settings. So what exactly is the difference between a functional assessment and a functional behavior assessment? Functional analysis involved the direct manipulation of antecedent and subsequent variables paired with the direct measurement of student behavior. Functional behavior assessments tend to be more common in school settings and consist of both indirect measurements, such as interviews, rating scales, direct observations through descriptive summaries of behavior patterns due to environmental events that are not directly manipulated as a part of the assessment. At my clinic, FBAs are conducted by the board-certified behavioral analyst. They tend to conduct these assessments during initial assessments when they are directly and indirectly observing the clients. Whether it is at the clinic or in-home with the parents, when conducting the assessment during the initial intake, our BCBAs prefer to observe the client in their natural environment to see what behaviors may occur throughout the assessment. Other occurrences of when the assessment is being conducted can be when the client is showing signs of different behaviors. The BCBA will determine what the function of their behavior is and take data on what the antecedent and the possible consequence is. Functional analysis tend to involve the environment along with behavior, such as why the behavior is happening. The BCBA will then look at the function of the behavior, which may consist of alone interaction, attention, escape, tangible, and play. However, according to IDEA, a FBA should be conducted if a child's behavior is affecting their learning. Normally, an entire process of conducting a FBA could last up to 30 days. However, the professional that is actually conducting the assessment can take approximately up to 2 hours depending on the severity of the client's behavior. Some of the steps that partake when conducting an FBA consist of documenting the client's information, taking note on the client's target behavior, the antecedent, which means what occurred before the behavior, any existing events that may be affecting the target behavior, consequences that usually happens after the behavior, observations regarding ABC data, interviews such as interviewing the parents, students, or teachers. Additionally, looking over the students' records and seeing if they have any prior disciplinary history, academic performance, or prior assessments. Another thing to look out for when conducting the assessment is influencing factors. Examples of those may consist of environmental factors, physiological, or emotional factors, factors related to family, friends, or significant others, and so forth. Lastly, determining the function of the behavior may include data that is used to formulate a hypothesis regarding what the function of the individual's behavior is. This allows the professional to determine the cause of the behavior. So, here is an example of a functional behavior assessment data record sheet. As you can see, the document provides a section for you to fill out the student's name, date of birth, and the date. Additionally, the form allows you to take data on a series of things such as the description of target behavior, the setting in which behavior occurs, frequency of behavior, intensity of behavior, duration of behavior, antecedents, concurrent events, and the consequence of behavior. And then this other page shows the background information which you can fill out. So when you are implementing this procedure or this assessment, you can write out the observation times and the dates when you're doing it and where the setting is or where the assessment is located. Further on, you can see that you could do interviews, so you could you can check off whether or not you did it with a parent, student, school staff, and so on. And then next on the list is the student records. So you can fill out whether or not there was attendance, discipline, academic performance, and prior assessments, health records, and other records that occurred when doing this assessment. And then in the back, you can also check off the physiological factors, environmental factors, factors related to a curriculum, response to prior events, psychological and emotional factors, and factors related to family, friends, and significant others. Honestly, this assignment definitely gave me a refresher on functional behavior assessments and functional analysis. I definitely have learned so much about FBAs and FAs from my coursework in comparison to my clinic. My supervisors have not really educated me on the assessment, nor have I seen her conduct one, other than the times I've asked questions when working on assignments regarding the functional or the FBA and the FA. I think I would like to learn more about when it is appropriate to do these assessments. For example, do both assessments have to be formally implemented, such as FBAs? I've learned that many FBAs are conducted based on the IDEA. If a student displays behaviors that are impacting their academic scores, then I can see why functional behavior assessments are conducted. However, can functional analysis be performed anytime? If you notice that a student or client is displaying repetitive behaviors, what time frame would it be an appropriate time to conduct these assessments? I have learned so much from this assignment, and I know that this information that I have obtained will benefit me and my career as a future board certified behavioral analysis.